Okay, I will be demonstrating on how to administer a primary intravenous infusion via gravity. And my name is Nurse Athena Green. Alright, we will start off by getting our supplies together. And so we have our 500, we read our order, and our order is for Miss Ellen Davis, date of birth 9/19/1963, no known drug allergies, from Dr. Jones. She has a diagnosis of CHF and pneumonia. He has an order for her today for 500 ml of sodium chloride at 125 milliliters per hour. And when you do the calculation, it is 500 milliliters over 60 minutes times 10 drops per minute, and it equals 83 drops a minute. So I will start off by getting my supplies, which is my 500 ml of sodium chloride, my flushes. I had already flushed my patient's line and everything. My primary line right here, my drape for underneath my patient's arm, my sharp box, my hand sanitizer right here, a pair of scissors, my label that will go on my line, and I already have a label on my 500 ml of 0.9% sodium chloride, and tape. The tourniquet I already used. As you can see, my patient's arm is already done as we were told in the video. I'm going to start off by washing my hands. And introducing myself, Miss Ellen Davis. Dr. Jones just gave me an order that you need to get hydrated with 500 ml of sodium chloride. I just need you to let me know if you start having any pain, or the area gets tender, or you feel any leaking from anywhere or anything like that while the IV therapy is going on. And if you can you please tell me your name and date of birth? And her name is Ellen Davis, 9/19/1963, no known drug allergies. Checking her name in against everything. And now I'm going to don on my gloves to assess her IV site, her peripheral IV site. It's in her right median antecubital, her arm, upper right here, right in the median. And the patency is good, no occlusions. Her limb is symmetrical. There's no signs of redness, no signs of inflammation. I did the IV flush already, and it flushes well. It gave a black backflow of blood. And now, Ms. Davis, does this hurt at all? And she said no. So we're going to take the gloves off, and we're going to get our IV set together. And I also have my hook, that's my IV hose. So I'm going to start off by taking my IV line out of this container and keep it sterile. IV solution. As you can see, It's the 500 mLs of 0.9 sodium chloride. There's a label on the back with the patient's name, date, and then my initials. The rate, 125 milliliters per hour. Infusion start time will be at 1500, and infusion complete time would be in 4 hours from that, which would be 1900. Sorry, I gotta close my clamp first. Mistake. And it's not easy to spike. Jeez. All right. Here. Get my line together. That's fine. Just gotta get my line together because I have to prime my line. And I would squeeze this a little for it to get halfway full. That's good enough. A little bit over. And so I'm going to use this to prime my line. Right now I'm just letting it prime. Going all the way through my line. Alright. And I check my line for any air bubbles. Down. All right. All right. And so next, I would take a alcohol wipe. Off of here, and I can get a different piece of tape after the fact. Get a little let go. And I'm just gonna unclamp that. There's no fluid's going into it right now. 1, 2, 3. For 15 seconds. All right. Now, I'll pretend like this wouldn't be up here like this if we were in a regular room, a regular patient's room. And so to get my rate flowing at 83, it will be right there. And as you can see, it's going into the patient's arm right there. Okay. All right, my video might have got cut off a little bit, but so after the procedure is done and I ran the IV for 4 hours and it's now 1900, within those, every hour I will come check on the patient, make sure everything's fine and the patient's not having any pain or complaining of anything, and make sure that the patient is okay. But then after starting it, I will come and document in the MAR the date 8/9/2020 and the time that it was the time I started it, which was 1500, and I will write down peripheral IV catheter insertion, 22 gauge in the right arm, median cubital vein, 1 attempt done, tourniquet used, blood returning catheter, IV flushes with 5 ml of normal saline flush, Tegader and transparent dressing, paper tape used, stat lock stabilization device used, sodium chloride 0.9% sodium chloride, infusing at a rate of 125 ml per hour that Dr. Jones ordered per doctor's orders. Patient tolerated procedure well, no adverse reactions to insertion or IV therapy, no interventions required. And I will also document that in the INO sheet, which I would add 500 ml. Once it's completely done, I add the 500 ml onto anything that she has drank, like water, coffee, tea, juices, anything that she's had which was liquid, we would add it to her INO. And that would be it. So I would just discontinue the IV line. Once again, I will come in and, Ms. Davis, are you okay? Are you having any pain? Is there anything that I could get for you? And the patient states no, so I would just take and don on my gloves. And take the IV down. So I will get my piece of tape. So I'm going to tape her IV back up. In the hospital, we have the alcohol swab things that keeps I'm going to clamp this off. That keeps the IVs from getting unsterile. And this would be trash. Alright, so I realized I missed a part in my video where before I put the catheter on, before I put it on, I take the blue drape. Jeez, this is a long blue drape. And I will place it underneath my patient's arm. Just like that. And then add IV line. Well, I'll pull that again. One. and then you attach the IV line. And when everything is done, I would take this drape from underneath my patient.